I am asking New Brunswickers to practice social distancing in all your interactions with your neighbors, co-workers, and fellow citizens. It is imperative that everyone keep a distance of 2 meters or 6 feet between themselves and others at all times. This practice, along with common hygiene practices such as regular hand washing, appropriate coughing and sneezing etiquette into our elbow, is our best chance of limiting the spread of the virus within our province. Aujourd'hui, je demande à tous les Néo-Brunswickois d'adopter le principe de distanciation sociale dans toutes leurs interactions avec leurs voisins, leurs collègues et leurs concitoyens. Il faut absolument garder une distance d'au moins 2 mètres ou 6 pieds avec autrui en tout temps. Cette pratique, ainsi que les pratiques d'hygiène courantes comme se laver régulièrement les mains et le fait de tousser ou d'éternuer dans sa manche, constitue la meilleure façon de limiter la propagation du virus dans notre province. Here are some actions that we can all take to reduce the likelihood of containing this virus. Postpone or cancel non-all essential travel outside Canada. Avoid large gatherings or crowds, and if it is possible for you to do so, work from home. I have recommended to the Premier that New Brunswick's public sector focus its efforts on providing critical services, with all employees working from home wherever feasible, and redeploying staff to focus on the most critical activities and to contribute to the overall effort. This must be done so that our healthcare system can meet the demands that will be placed upon it. We must do this to help our doctors, our nurses, and our other valued healthcare workers cope with the situation. I am also recommending the following. Private sector companies encourage their employees to work from home wherever feasible and focus on critical activities. Child care providers close, with the exception of those that provide services to essential service workers such as healthcare workers. The following businesses and public spaces must be closed effective tomorrow, Tuesday, March 17th, until further notice. Libraries, museums, theaters, swimming pools, spas, saunas, water parks, recreational sites such as ski resorts, amusement parks, trampoline centers, and so on. Cinemas and arcades, bars and discotheques, restaurants that offer buffets. J'ai recommandé au Premier ministre que la fonction publique du Nouveau-Brunswick se concentre principalement sur la prestation des services essentiels et de faire en sorte que tous les employés qui peuvent le faire travaillent de la maison. Je recommande également de réaffecter les membres du personnel aux activités les plus essentielles et de faire en sorte qu'ils contribuent à l'effort global visant à freiner la propagation. Nous devons agir ainsi pour nous assurer que notre système de soins santé soit en mesure de répondre à la demande à laquelle il devra faire face. The action we are asking each and every New Brunswicker to take can and will save lives. This is our opportunity, right here, right now, for all of us to make a difference in stemming the tide of the virus. We can and we must act together to flatten the curve of this epidemic. If we are to mitigate the impact of COVID-19, each of us has a role to play. It will take more than the government action to protect the health and the safety of Canadians. It is important that each and every one of us understands how the coronavirus spreads and the actions that we can take to prevent the spread of illness. Of primary importance at this time is for everyone who can do so is to stay at home, regardless of where you live, regardless of whether or not you have traveled outside the province. Staying home will save lives here in New Brunswick. Pour atténuer les conséquences de la COVID-19, nous devons tous contribuer à l'effort de guerre. Il faudra plus que les mesures prises par le gouvernement pour protéger la santé et la sécurité des Canadiens. Il est important que chacun de nous comprenne comment se propage le coronavirus et prenne connaissance des mesures à prendre pour freiner la propagation de cette maladie. Pour le moment, il est d'une importance cruciale pour tout le monde de demeurer à la maison dans la mesure du possible. peu importe où vous vivez ou si vous avez voyagé ou non à l'extérieur de la province. Le fait de demeurer à la maison permettra de sauver des vies ici au New Brunswick. Respiratory viruses like COVID-19 are spread through contact. We can therefore reduce the chance of spreading the virus by limiting contact. Instead of your customary hug or handshake, a friendly wave or elbow bump is less likely to expose you and others to viruses. I encourage everyone to get creative. We are fortunate in living in an age where we have access to technology that provides us with opportunities to learn, participate in physical activity, shop for essential items such as groceries, cleaning supplies, and prescription medications. We can use video conferencing technology, calling and texting to stay in contact with neighbors, friends, co-workers, and loved ones. Social distancing does not mean social isolation, especially in our world today. This is an opportunity to use creative means to maintain contact with the wider world while protecting your own health and that of your fellow New Brunswickers. But technology can be stress-inducing as well. You can be exposed to misinformation and confusion that proliferates on social media. Be sure to take regular breaks from your devices so that you can care for others and care for yourself. We must all protect our mental health as well as our physical health. Je vous encourage tous à faire preuve de créativité. Nous sommes chanceux de vivre à une époque où nous avons accès à des outils technologiques pour permettre d'apprendre à faire les activités physiques, de magasiner pour des produits essentiels comme les produits alimentaires, les produits de nettoyage et les médicaments sur ordonnance. Nous pouvons nous servir de la vidéoconférence, du téléphone ou des textos pour demeurer en contact avec nos voisins, nos amis, nos collègues et nos êtres chers. There are plenty of activities that we can safely engage in to renew our spirits, such as reading a book, playing a board game, having a family day dedicated to unplugging. Let your neighbors, family, and friends know that you are making plans to prepare for COVID-19. Share your plan with them, as this may motivate them to make a plan for themselves and their families. I suggest creating a buddy system so that people agree to regularly check in on one another so they can run errands and generally look out for one another. And I have to say, since the beginning of this, in the last few weeks, I have actually had the personal experience of many, many people reaching out as things have gotten busier and busier. So I would love to see all of us in New Brunswick reach out to our family, friends, and neighbors to do the same. It's really important, not just for the physical things that you need to get, but also for the support on the emotional side as well. COVID-19 is present in New Brunswick, but we can still limit the spread of the illness if we all act together, remain calm and determined, and look out for one another. I am confident this virus will not overwhelm us. Thank you very much.
Hello, I'm Dr. John Dornan, Chief of Staff for Horizon Health Network, and by practice I'm an endocrinologist in St. John, New Brunswick. I do have a few short messages here that I hope are concise and clear. In Horizon and in Vitalite, we are reducing surgical access. We are concentrating on doing surgery on people that need it today. Urgent surgeries, limb-saving surgeries, cancer surgeries and the like. People that are anticipating elective surgeries will be contacted by our facilities, our surgeons, and our team. This is a significant undertaking, and we believe that it will reduce the transmission of coronavirus in our facilities. If you have any questions, please contact your surgeon's office, and they will help you with respect to rescheduling, or if your surgery is that critical that it must proceed. We are doing the same in ambulatory clinics. Many ambulatory clinics are what we would call elective. People are seen for follow-up of their diabetes or thyroid disease or asthma or the like. We will be reducing these significantly and conducting them only on an as-needed basis. there are other opportunities. This morning I was scheduled to do a busy clinic in St. Stephen, and we discussed what we would do about that, and eventually I conducted what we'd call a virtual clinic. From St. John, I didn't see a single person, but ran a full clinic. I called people, gave them the results, told them what they needed to do, and arranged for appropriate follow-up. Not a single person was put off by that approach. We need to be creative, and my colleagues are going to be taking a similar approach. We have assessment centers, and these are sometimes called parking lot or surge clinics. These are clinics where people will be sent if they have a significant concern or possibility of having HIV. These are not information clinics. If you feel well, do not go, do not call 811. Access to these clinics is limited exclusively to calling 811 or by being sent there by your family doctor. If people feel that it's a shortcut to go to these clinics directly, you will have undone our whole purpose. In wartime, we don't send all of our troops over the line at the same time so that the enemy can shoot us all. We do it creatively. In this instance, we want to make sure that people that are going to these clinics are expected, are seen on time, and are discharged on time. If anybody in our community, whether it's healthcare workers or doctors or patients or media, think that they should just overwhelm these clinics, people will come that have the disease, and God knows they'll spread it amongst everybody that's there at the same time. So please respect our advice to go to these assessment clinics, call 811 or your family doctor who can set up an appointment to be seen there. This is probably the most important message that we have today. We have clinics set up in all our communities, both in Horizon and Vitalite. We are prepared. If clinics are overwhelmed by people just driving up or walking up, we will not be prepared for that. Our hospitals are restricting access. This means that not everybody, not anybody will be allowed in to see our patients. And we ask this that we can curtail the spread of corona in our healthcare facilities. If someone meets a friend for a cup of coffee at Tim Hortons, picks up a virus which is transmittable for at least a few days, and walks into our facility and interacts with lots of people there, we're sunk. Please respect this limitation on access. There will be exceptions, and if you call or contact our hospital, we will tell you what those might be. You know, take care on your information. There's lots of stuff on the internet, and as Dr. Russell has suggested, you can overwhelm yourself with real, false, and changing information. Use Horizon and Vitalite and Government of New Brunswick websites. They're current. They give you good advice. Don't watch it 24 hours a day because it's not going to change every 5 minutes. But check in by time so that you are aware of what the current status is. If you're considering checking out our 811 resources, already they have been overwhelmed. Fortunately, 811 folks have brought in extra lines. We are hopeful of dealing with the onslaught. But you can help. If you're just calling for information, go to a website. If you know that you're already self-isolating and you're not unwell, don't bother calling. But if you're not really sure, call and you will be directed accordingly. 811 might tell you to stay home. 811 might tell you to go to the assessment clinic. 811 might tell you to go directly to the hospital. These are their options. Already they have significantly reduced the number of people that are presenting in our emergency departments, and for that we're extremely thankful. Our hospital employees are essential. They are part of our essential services. It's important that they are not considered private sector companies. It's a different ballgame. We rely and depend and are thankful for all our folks, doctors, nurses, house cleaning, respiratory therapists, everybody that comes to our hospital every single day. There are some people in our facilities that already do some work from home. This is not going to change tomorrow. So we're very respectful that our people continue to come to work. It's critical. In that vein, I'd like to be very thankful. You know, we don't come up with these ideas, we don't, aren't fluid, aren't dynamic without input from experts in the field. Our anesthetists, our infectious disease consultants, our internists, our family doctors, daily, myself and other leaders get very valuable input, reaction, and suggestions. And for this, you know, it's emotional to be part of such a healthcare team that works with New Brunswickers. As has been said, you know, a term that's used a lot, flatten the curve. What does that really mean? Well, you know, a lot of us are going to get infected. What we want to do is lessen the number of people that are extremely ill, that require intensive care and ventilator support in our province. By doing that, we can handle this crisis. If we don't do that, if we allow ourselves to get infected, and as some people say, well, why don't I just go get it and get it over with? Well, guess what? You might be okay, but the next person that you infect might be a senior person that requires a ventilator that's not there. So take care, listen to advice that you get from Dr. Russell and others, and for that I'm very thankful.
Bonjour, je m'appelle Nicole Leblanc, je suis médecin-chef du réseau de santé Vitalité, puis je suis aussi pédiatre. Dans Vitalité, on a aussi plusieurs annonces qui sont alignées avec celles présentées par Dr. Dornan et Dr. Russell. De notre côté, depuis vendredi, le 13 mars, on a débuté notre premier centre de dépistage dans la région de Moncton. Dès demain, mardi, le 17 mars, nous aurons des centres de dépistage dans plusieurs endroits, tels qu'Edmundston, Grand-Sault, Campbellton, Bathurst et Tracadie-Shaila. Au fur et à mesure qu'on va voir que le besoin augmente, d'autres centres de dépistage seront ouverts. Un peu comme Dr. Dornan le mentionnait tantôt, pour avoir accès à ces centres de dépistage, on appelle 811 ou on contacte le bureau de notre médecin de famille. Si on veut que le système fonctionne et qu'on minimise la contagiosité, il faut respecter les consignes. Si vous cherchez de l'information générale concernant le coronavirus, on vous prie de, s'il vous plaît, vous diriger vers les centres, les websites, au niveau de l'Internet, les sites web. Par contre, si vous avez des symptômes, puis que vous souhaitez avoir un dépistage pour la maladie, à ce moment-là, vous appelez 811 ou vous contactez le bureau de votre médecin de famille. Le centre de dépistage est un centre avec rendez-vous. Je vous explique le pourquoi. Si demain matin, on a plein de gens qui se rendent à l'urgence, on va juste augmenter la contagiosité. Les centres avec rendez-vous ont été faits selon l'expérience et l'expertise de partout ailleurs au Canada et à l'international et vont faire en sorte qu'on va minimiser le risque de contagiosité. Et aussi, c'est fait pour faire en sorte qu'il n'y ait pas de salle d'attente. Donc, ça va nous permettre de voir un patient à la fois, puis d'être capable de bien procéder au nettoyage entre chaque patient. Les hôpitaux sont aussi dans la phase de réduire l'accès au public. On sait que ceci peut causer certains inconvénients. En même temps, vous comprendrez que pour les mêmes raisons, on vous demande de respecter la consigne afin de protéger nos plus vulnérables et aussi de minimiser cette contagiosité. J'aimerais aussi vous aviser que nous sommes en phase active de notre plan de pandémie. Dès maintenant, nous identifions les cas prioritaires qui doivent être vus. Cela veut dire que les situations urgentes, et par urgente, je veux dire des situations de vie ou de mort, comme exemple un cancer, ou qui peuvent mettre à risque soit un membre ou un organe, seront priorisées. Donc, il se peut que dans les prochains jours, vous receviez un appel de votre médecin, de votre chirurgien ou d'un personnel ou un membre du personnel de la santé pour soit annuler une clinique, annuler un rendez-vous, un examen, une chirurgie qui n'ont pas été jugés prioritaires pour le moment. Ces rendez-vous seront évidemment recédulés dans un temps en fonction des prochains mois. On vous demande d'être indulgent. On sait que la situation est non optimale et que ça va probablement occasionner plusieurs inconforts. Soyez assurés que c'est temporaire et encore une fois, c'est pour minimiser les contacts et la contagiosité et orienter notre personnel vers les besoins prioritaires. La situation, comme Dr. Russell vous l'a mentionné, évolue de jour en jour. Je vous apporte peut-être quelques petits conseils pour tenter de maintenir une meilleure santé mentale ou une bonne santé mentale. On sait que l'anxiété avec cette crise-là, elle est réelle. On la voit, on la palpe. Elle est due au fait qu'il y a beaucoup d'incertitudes avec le coronavirus. Il ne faut surtout pas nourrir cette anxiété qui peut évoluer vers la panique et des décisions irrationnelles, un peu comme la panique du papier de toilette. On vous demande donc de privilégier des sources d'informations fiables. Suivez les consignes. Évitez autant que possible d'écouter les nouvelles en continu. J'ai consulté avec nos experts en santé mentale. 1 à 2 heures d'informations fiables sont suffisantes pour demeurer bien informé. La surinformation va juste faire augmenter l'anxiété. Tentez d'établir une routine dans cette nouvelle réalité. Continuez l'exercice, de bien manger, de bien dormir. On peut quand même aller prendre une marche dehors. Puis dans une routine, des choses comme faire l'épicerie. Nos autorités nous disent, on ne va pas manquer de nourriture. Fait que, oui, vous pouvez continuer à aller faire l'épicerie, mais tentez de le faire sur une base régulière. Exemple, 1 fois par semaine, dans la routine, d'y aller avec moins de gens et pendant les moments qui seront moins achalandés. Et s'il vous plaît, si vous sentez que cette anxiété vous envahit ou que ça paralyse votre fonctionnement, consultez. Sachez que toutes nos équipes sont en mode action. On se prépare, on tente de mettre toutes les mesures en place pour, comme on l'a mentionné, aplatir la courbe. On travaille d'arrache-pied pour réviser les données de dernière heure, d'apprendre de ce qui se passe dans les autres pays et de faire évoluer nos mesures pour minimiser les impacts du COVID-19. Juste en fin de semaine, j'avais des collègues microbiologistes puis des gens des soins intensifs qui nous disaient on est en contact direct en fin de semaine avec le Québec, avec des intensivistes dans d'autres provinces pour voir comment les gens vont, de quelle façon qu'on est organisé, fait qu'on est chanceux tout de suite qu'on est capable d'apprendre de l'expérience des autres et soyez assurés qu'on le fait sur une base régulière. C'est vraiment un travail collectif où chaque individu a sa part à jouer. J'aimerais remercier, moi aussi, toutes nos équipes qui sont au front et au poste de ce grand rendez-vous. On est choyé au Nouveau-Brunswick d'avoir des gens de terrain et des leaders extraordinaires qui sont dévoués et qui sont très compétents. Moi aussi, j'étais très émue en fin de semaine de la quantité de gens qui m'appelaient pour offrir leur aide, que ce soit des collègues médecins, infirmières ou des gens de la communauté. Mais maintenant, moi, je pense que la responsabilité est vraiment à chacun d'entre nous de faire notre différence. S'il vous plaît, évitez les rassemblements, pratiquez la distanciation sociale, suivez les recommandations de nos autorités sanitaires et de la santé publique et lavez-vous les mains.
Good afternoon. Bonjour. I want to reassure New Brunswickers that your government continues to monitor the situation closely and to manage the situation following closely the advice of our medical professionals. Je tiens à rassurer les gens de Nouveau-Brunswick. Le gouvernement continue à surveiller la situation de très près et très réagir lorsque il est nécessaire de le faire. I know that things are developing quickly and that all the information coming out may seem overwhelming. We are listening to the recommendations made by Public Health and taking actions to implement those recommendations. Starting tomorrow, we're shutting down all non-essential government services until further notice. All public sector workers who work in critical functions or areas that are supported by critical functions remain on the job. They may be on site or working from home, depending on the job. Like other jurisdictions, these workers will remain on the payroll. They are required to remain on standby to be deployed to help in critical service areas, either because critical staff are sick or because additional staff is needed. We are working with public sector unions on worker mobility agreements to allow employees to be deployed to other work regardless of the collective agreement. It is times like this that we actually see the best in New Brunswickers as we pull together for the greater good. We know the best and safest place for our workers and their children is at home. We recognize, however, that essential workers will still be needed to maintain the key functions of our systems. In response to today's recommendation to close daycares, the Department of Education and Early Childhood Education has developed a response plan to support essential workers across the province and ensure childcare for people like our healthcare workers, including doctors, nurses, and support staff. Information for essential service workers will be available through the Department of Education and Early Childhood Development's parent portal or by calling 1-833-221-9339. Facilities operating to support essential service workers will follow the advice set out by the Chief Medical Officer, including reduced group sizes and social distances. In addition, they will continue to follow strict health and safety directives. We continue to ask New Brunswickers to come together and support one another. Families, neighbors, and friends who are not in high-risk categories are encouraged to work together to ensure child care options are available for our essential service workers. We are taking steps to ensure government officials are leading by example as we continue to ask residents to practice social distancing. That's why our all-party Cabinet Committee on COVID-19 has made the decision that tomorrow only a quorum of 15 members will be meeting at the Legislative Assembly. Each party will determine which of their representatives will attend. These reduced numbers will allow us to spread out and will help ensure we're limiting any potential spread of illness. Chacune des parties va déterminer lequel de leurs représentants sera présent. Avec moi, des représentants, nous pourrons respecter les distances recommandées entre les personnes et donc limiter les possibilités de transmission des maladies. We are asking New Brunswickers to not visit the province's nursing homes to help protect our most vulnerable residents. Friends and family members are asked to limit their communication with residents of long-term care facilities to phone calls and social media, such as FaceTime and Skype. I recognize that this is a difficult thing to ask, but we must do everything we can to protect our most vulnerable residents living in long-term care facilities. Je suis conscient que c'est une demande difficile, mais nous devons faire tout ce que nous pouvons pour protéger nos gens les plus vulnérables qui vivent dans les établissements de soins de longue durée. Those over 70 years of age are at the highest risk of becoming infected with COVID-19. If you are over 70, please stay at home and limit your contact with others. As well, Public Health has new directives on public spaces that I encourage all New Brunswickers to follow. Working together and following the recommendations from Public Health, we can all play an important role in flattening the curve. Flattening the curve means that instead of exclusively focusing on preventing infections, authorities are shifting to a strategy of delay. The objective is to keep the rate of new cases, especially serious ones, from rising too steeply so that the epidemic doesn't completely overwhelm finite resources and force hard choices about who should be prioritized for health care. We have seen this happen in other countries, and we do not want it to happen here, and we're convinced we can manage this so it will not. If you have the symptoms of COVID-19, including high fever, a dry cough, and difficulty breathing, please isolate yourself from others and call 811. You will be walked through the next steps you need to take. If you do not have symptoms, please do not call this line. The normal number of calls per day is 200. Since COVID-19, that number has increased by 1,000 calls per day. Please do not call 811 for general inquiries. This afternoon, the federal government announced it will be denying entry to Canada to people who are not Canadian citizens or permanent residents with designated exceptions. Please know that residents of Campbell Island will continue to be allowed to cross the border into the U.S. and back into Canada as they have always done so. We want to alleviate the fear for those who live there. Also, the travel restrictions will not apply to commerce or trade. Anyone with symptoms of COVID-19 will not be allowed to come to Canada. The border is not closed to Americans. Instead, Canada is working to coordinate efforts with the United States. I want to once again thank our Chief Medical Health Officers and her team, as well as the entire team of our Department of Health and Emergency Measures, and also the representatives of the RHAs that are here today. They've certainly clarified in real terms how this can be managed effectively in both health networks. These frontline employees have been working diligently to reduce the impact of the virus on all New Brunswickers, and I'm very thankful for their dedication. New Brunswickers are resilient, and we are stronger when we work together. We need to take care of ourselves, take care of others, look after one another. Les gens de New Brunswick sont résilients, et nous sommes plus forts lorsque nous travaillons ensemble. Prenez soin de vous et des autres. Stay home and save lives. That means that normal morning visit at the coffee shop, or when you're coming back from the south of the country and you haven't seen your friends for a long time, and you've been down in the U.S. maybe and vacationing as many snowbirds have been, call your friends. Don't go visit. Say you're in self-isolation and you're there to protect your neighbors and you're there to protect yourself. We need you to be part of this solution. So I emphasize, stay home and save lives. Thank you. Merci.
Silas Brown.
Hi there. Dr. Russell, we're only a couple days away from Friday when you said that you would support school closures but recommended that daycares remain open. And now just a couple days later, we're seeing you're recommending that those close along with a whole list of other public gathering places. Why these additional measures just a couple days after recommending that daycares stay open?
So this is such a quickly evolving situation. We are getting a lot of new information every day about the seriousness of the situation across Canada. And we have to take these measures to protect New Brunswickers. We really are trying to be proactive because these are the measures that are going to protect our healthcare system and our healthcare workers from being able to deal with more and more cases of coronavirus, which we know we are going to see. So we have to flatten the curve, which is to delay the onset of more of those cases and the volume of them, and keep people out of the hospitals as much as possible. So these steps are absolutely necessary to help New Brunswickers cope with this, and you have to stay home. That is the only way that we're going to decrease those numbers and keep again, to protect our healthcare workers, to protect the resources that we have in the entire system.
Matthew Guacomo.
Bonjour, probablement une question pour la docteure Leblanc. On a entendu dire que les travailleurs de la santé qui sont de retour de l'étranger, on leur demande quand même de se présenter au travail. Est-ce est-ce que c'est vrai? Puis comment expliquez-vous ça, sachant là, que les autres employés de la santé, les autres personnes qui arrivent de l'étranger, on leur demande de s'isoler pour 2 semaines, mais on demanderait aux travailleurs de la santé de venir travailler immédiatement.
En fait, les consignes d'isolement volontaire sont les mêmes pour tous. Donc, les personnels qui travaillent dans le système de santé actuellement, qui arrivent de voyage, on demande la même consigne, c'est-à-dire des gens qui viennent de l'international, c'est de respecter la consigne de l'isolement volontaire.
Michel Corriveau. Michel.
Oui, sorry, pardon. Madame, Dr. Russell, pour ce qui est des foyers de soins, est-ce que les visites sont interdites de façon obligatoire ou est-ce que c'est une suggestion?
C'est une recommandation.
OK, donc les gens, c'est seulement une recommandation à ce point-ci, là, c'est pas une obligation. C'est la même chose pour les foyers de soins spéciaux?
C'est ça. Oui, exactement. Recommandation.
OK, puis les services de garde à la maison, est-ce que c'est inclus dans ce que vous avez annoncé aujourd'hui?
Alors, l'annonce pour les garderies puis tout ça, ça va être quelque chose, on va avoir quelque chose de supplémentaire pour les travailleurs dans les secteurs criticaux, tellement nécessaires.
I have a question for Mr. Higgs.
Michelle, can we go? We'll cycle back to you. Jacques Poitras.
Hi, I have a question about the schools, and I'm not sure who can handle it, maybe the Premier, on whether there's any system in place for students who are at home to be in touch with teachers, get homework, online classes, and what also is going to happen to school breakfast and lunch programs. Are there any alternatives being contemplated?
Yes, in fact, in both cases, I know teachers are now setting up some online programs or making suggestions that students should be certainly reading, staying current in their literacy. So it's not all about video games. It's about keeping active in that regard. But the teachers are actually looking at some online activities and scholastic services in both official languages, and so that they will be able to continue learning. So I'm pretty, I guess I'm pretty encouraged by the preparation that's being put in place in that regard.
Andrew Waugh.
And on the lunch programs and breakfast programs?
In regards to those programs, it's been interesting. We've seen some private companies that have been stepping up as well to help in assisting in that manner, to understand the need and to ensure that the most vulnerable and in our society that have actually been participating in these programs don't get left behind in the school closures. So that is in under works in addition, and it's been as part of the overall priorities put in place by EMO in terms of what critical services are being utilized today in communities that we need to make sure don't fall through the cracks. That is certainly one of them.
Andrew Waugh.
So this one, I'm not sure who to, but two parts. First part, how many ventilators do we have inside the health system? And second of all, Premier, you said that the 811 calls were increasing from 200 to 1,000 a day. Is it 1,000 a day, or are they increasing by 1,000 a day?
It's 1,000 a day. So they've gone up 4 or 5-fold. And
they've gone from 200
and that's over the last 5 days we've seen that sort of volume. And if you think about the number of cases we have or the number of tests we're performing, it's extremely low. But in this sort of case, people are complaining, they're calling 811, they can't get through, it's taking hours if they get a response. And this is the reason. Even though the capacity has been over doubled, the ability to manage the large number of calls is going to create that sense of urgency that's unnecessary, because these aren't calls from people that are experiencing symptoms. They're calls from people that want information. And there's many other sources to get information. And I also know that the call system is being changed in order to prioritize and direct people who are not calling because of symptom, but are calling because of just want to get information.
Dr. Dornan,
what about the-
Dr. Dornan's going to go answer Andrew.
Okay, perfect.
Thank you very much. In terms of the number of ventilators, it's not a statistic that we normally kept. Ventilator numbers vary depending on the use of a given critical care area. But that is one of our statistics that we are collecting today, number one. It's also dynamic. Ventilator companies have been very generous, part of our healthcare community, at offering additional ventilators should that become necessary. And should it become necessary, we would consider ventilating patients in non-traditional areas, such as post-operative care and the like. So I can't give you that exact number today because it's fluid.
Thank you, Doctor. Vicky Hogart. Vicky?
I'm just wondering, you've made plans so that Campobello can return across the border, but are you considering if the U.S. closes their border to Canadians, what will you be doing for Campobello in order to ensure their safety?
So just to put that in context, right now, you know, as of this past weekend and started on last week, the concern was to follow closely with the U.S. requirements for international travel so that we didn't get out of step and we didn't threaten the North-South relationship. So because it is so important to our supply chain and the integration that we have of society moving back and forth, particularly New Brunswick with Maine. So I was pleased today to see the federal government come out with a strategy that reflects the same as the U.S. in relation to international travel and restricting that. But Canada is an exemption here. The Prime Minister, you know, reassured us and has had numerous discussions with the President himself. The Deputy Prime Minister, Chrystia Freeland, has assured us that she's working very closely with the U.S. authorities so that we don't see that restriction between Canada and the U.S. And that so Campobello Island residents can rest assured that they will be allowed to move freely as they have been over the many, many years. What we see is if we move forward down the road is that, you know, with a supply network that is so integrated that we may need to look at supply chains and the people involved in that and for essential services and movements, but that's not there just yet. And I think the big step today that I guess I would look at federally has been that alignment with the U.S. and how important that is to ensure that, you know, we are able to maintain our relationship and ensure we protect Canadians through this as well, because it's not all about one way. We need to make sure that although we're moving back and forth with U.S. and Canada, we need to make sure that our citizens are protected. And so looking at screening at borders, looking at questioning at borders for people coming back into Canada is going to be very important on a go-forward basis.
Thank you. Elizabeth Fraser.
Hi, my question is for the Premier. What contingency plans have been put in place by the provincial government to help parents if they have to take care of their children at home or during these school or daycare closures? And what should parents do if they can't afford or find childcare? Will they be punished financially for this?
Our intent is no, they will not be punished financially for this, and because we have a situation that we want people to do the right thing, and finances do not play a role in that decision making. So we're still working through the impacts of that. Obviously, first and foremost, we want parents to be able to look after their kids, and they should do whatever is necessary, especially in the non-essential situations or non-essential employment, where they'll be able to stay home and be able to look after their kids and keep their kids in isolation and protected. It's important that that's got to be first and foremost. Secondly, it's related to the non-essential workers particularly, who we need to ensure that they are able to go to work, and we need to provide a daycare option for them. And then to your point, thirdly, it's in the case of someone who is now forced to stay home, who doesn't have employment, but had a daycare service and being forced to kind of do both. We're looking at how do we mitigate that. The federal government has given us assurances that there will be money there to help us. We don't know the details from the federal government yet, but at this point in time, we're meeting and having meetings every day And today, Prime Minister Trudeau talked about that, but said details would be coming. So we are pressuring, just as we are pressuring for a border, movement of people from other countries internationally and have some comparison with the U.S. in that regard. We're pressuring for clarity on this financial package so we can protect those that need to be protected financially.
Thank you.
Okay, and I do have
hang
some
on,
questions
Elizabeth.
related to hospital concerns.
Elizabeth?
There have been reports of people stealing gloves and masks and hand sanitizers from New Brunswick hospitals. Is this true? And if so, how do you fix it? And what is the chance that we run out of these products?
It's John Dornan. Thank you very much for the question. We don't have evidence that that's occurring, but we're worried. We're worried about running out of products, particularly the N95 masks. We have looked at the international literature to make sure that people are using the right protective tools at the right time. And so we've told our staff that, please don't hoard this stuff. It's not yours, it's ours. And we are trying to manage it appropriately. We think that if our staff and our patients are using the appropriate protective equipment, then we will have enough. And so that's our strategy there.
Thank you. Before we proceed, Elizabeth?
What about staffing? Will medical students, nursing students, will they be called upon at all to help with this?
Elizabeth, we're going to move on. We ask the reporters, please place your phones on mute after you ask your question. Laura Brown, are you on the line?
I am. Super quickly, I need to know if these are recommended measures by the Chief Medical Officer of Health, but the Premier, have you accepted these? And in regards to the recommendation for childcare closures, it says that anybody who is essential, a healthcare worker who has children, where do they find a daycare that can take their children, and how do they go about that process?
So right now, the Department of Health and Department of Education are working together to identify and do this in a cross-province initiative so we can identify the needs, identify the locations, and then make that information public. I would suggest that information will be coming out within the next 24 hours, and that'll then give people inside knowledge of where to apply.
And what about cannabis and B&M liquor? Are they staying open for the time being?
They are for the time being. However, there will be restrictions in terms of access to the stores so that they will be limiting the number of people in the store at any one time, respecting the safe distancing health initiatives so that we can actually, just manage the connections and the process. It may come to closure, but at this point in time, we're not there yet.
Okay, we're going to
And again, sorry, just to
Laura,
confirm, you have accepted all recommendations from the Chief Medical Officer of Health today. These are all accepted by your government.
Absolutely. We're working hand in hand here on mitigating risk, ensuring we react quickly to the needs, and our goal is to, as we've said earlier, we've all said, flatten the curve so that we don't see this peak. And I would like to just respond to the question about the resources and the overuse or missing. The biggest challenge we're going to have if people don't think about their neighbors, and if they think more about themselves and less about their neighbors, and we get into a situation where someone says, well, I'm fine because my garage is full of supplies. That's not what's going to pull us through this. What's going to pull us through this is us very much thinking about our neighbors. And that's not a matter of going to the neighbor and exposing them or yourself. It's about calling. It's about, can I help? Can I get groceries for you? Can I make a difference? And I know we've seen it already, and I mentioned it in my comments about the unions, because every union member has said, this is not a time to talk about a contract. This is a time to talk about getting results and working together to ensure we safely move us through this health crisis. And that's what is reassuring to me the most, is that people put down all the books and rules and say, okay, healthcare is number one. And what do we got to do to help in order to ensure that we maintain that integrity of our system?
Thank you. Silas Brown, do you have one more?
I do, yes. I'm curious about transit services across the province. Where those aren't included in the list of things. Will those potentially be shut down at some point moving forward here?
We'll definitely looking at that. So that's a really good question.
Thank you. Matthew Guacomo, do you have one more?
Oui, s'il vous plaît. Mr. Premier, you've talked about how it's going to work in the legislature tomorrow. Can you tell us some of the things that those 15 MLAs will be looking at, and will that include municipal elections?
It is business as usual, and yes, it will.
Thank you. Monsieur Corriveau, do you have one more? As-tu une autre question?
Oui, j'ai une question pour Madame Leblanc, Docteur Leblanc de Vitalité. J'aimerais savoir si il va y avoir éventuellement des services de système de dépistage express au volant là, qu'on a pu voir ailleurs.
Toutes les options sont sur la table présentement. Puis en fait, ce qu'on est en train de faire, c'est qu'on est en train d'y aller en fonction du besoin puis de la demande. Ça fait que oui, c'est une option qui est possible. On est en train d'explorer.
Jacques Poitras, do you have one more question?
Yeah, about the presumptive and confirmed cases. Do we know, are these patients separated from their families or with them, and what other measures are they following voluntarily, and is anything enforceable for those people? To Dr. Russell, please.
So as of right now, all the cases that we have and their contacts, my understanding is they're self-isolating at home. In terms of enforcing, we expect that people will follow the advice of public health, first and foremost. This is a crisis, and we expect that people will be staying at home and doing the right thing. If it came down to enforcing the Public Health Act and having an order written that someone had to stay home, then we definitely would do that. But as of right now, we feel that everyone is being compliant, and so that self-isolation is happening. I don't have the details about where they're self-isolating, but all of the information that would have been given to all of the cases as well as their close contacts, that was all provided by our public health teams.
Thank you. Andrew Waugh, as-tu une autre question? Do you have another question, Andrew?
Yes, I do. When do these closures take effect? And are they recommendations or like if a restaurant decides to ignore you, what happens?
These recommendations are effective tomorrow, and I think if restaurants choose to ignore the recommendations, I think they're doing a real disservice. But I'm not only talking about restaurants, I'm talking about any facility. I know it's a significant economic hit to a company or a business, but it could be a lot longer significant hit if we don't manage this health crisis effectively. So at this point, you know, I don't think we're going to go around count tables in restaurants. But we're relying on people looking at the overall public good and saying, you know, I want to be a business here 3 months from now or 6 months from now, and I need to do my part. So at this point, it's asking everyone to be part of the solution.
Vicky, do you have another question? Vicky Hogart. Elizabeth Fraser, one question. One.
I'm wondering about staffing. Will hospitals be bringing in medical and nursing students to be called upon to help? And I'm also wondering, given the number of ALC patients, and they're among some of the most vulnerable patients, where will people go who are sick and hospitals are at capacity? Where do they go?
Thank you very much, Vicki. It's a good question, one that we have considered. We are excluding access to hospitals by any salespeople, representatives, and as well students that are not there in an official capacity. For example, shadowing students from high schools, universities, and the like. They are precluded from entering our resources. We do have students that are in our resources, for example, medical students, nursing students, respiratory therapy students, who will continue to work with us as part of their educational opportunity. We don't anticipate using them for areas beyond their area of training. However, that remains a possibility depending on how many of our staff end up sick or having to self-isolate.
Laura Brown.
I'm good. Thank you, everyone. Appreciate it.
Thank you, everyone. Merci beaucoup à tous. Be
Okay.
safe.